So today we're going to make a more affordable AM and PM skincare routine for those undergoing Accutane. Hey everyone, it's Dr. Joyce Park, board certified dermatologist, and over the past few months, one of my videos has gone really viral here on YouTube. It's everything you need to know about Accutane. This video here, where I basically react to a bunch of videos about Accutane and share some important tips and tricks about Accutane. Now, one question I've been getting asked a lot on that video is, can you put together a skincare routine for patients who are taking Accutane? And I thought, of course I can. And because oftentimes it's teenagers who are going through Accutane, teens or people in their early 20s, I decided to make this routine more affordable using a mix of drugstore brands and other brands available at Sephora or Ulta or dermstore.com. And I hope you enjoy this and find this helpful. Before I start off, just want to do a really quick primer on what Accutane is and what happens to your skin in terms of side effects when you're on it, which will explain why I chose the products that are in this skincare routine. Accutane is vitamin A, essentially, and it's a pill that is taken for a course of 5 to 7 months, give or take, depending on how you do, and it is a treatment for severe nodulocystic acne. It is not a first-line treatment for acne because it does have a ton of side effects, notably on the hair, on the skin, can even affect the nails, and it can even affect internal organs. It can cause birth defects in a developing baby. It can affect your red blood cells, your white blood cells. It can affect your liver and your kidneys. It can raise your cholesterol and your triglycerides. Also, Accutane does have side effects where it can increase depression or thoughts of anxiety in patients who are predisposed to having mood disorders. So there are a lot of side effects, but as with any medication, as a dermatologist, I'm always weighing the pros and the cons. So if you're a patient who is suffering from severe acne and it is severely affecting your mental health, it's leaving scars on your face, and you've tried everything else, then perhaps Accutane is a good option for you. And I actually cover all of these side effects and more in this previous video over here, where I reacted to Alex Earle's Accutane journey and cover a lot of these myths and misconceptions. So please check out this video as well before I jump into this routine. Accutane works mainly by shrinking your oil glands or your sebaceous glands. So it makes your skin produce less oil. It also helps to normalize skin cell turnover so that it can help exfoliate and unclog some of your pores if you're having retention of keratin in your pores. So because of this way that Accutane works by drying out your skin, the main side effects of Accutane that a lot of patients face is dry skin, not only on their face, but on their whole bodies. Dry skin, dry lips, dry mucosa of the nose where they are prone to nosebleeds. And so a lot of the things that I talk about in this skincare routine for Accutane patients is going to be addressing that dryness all over the body. Other side effects of Accutane on skin include increased sensitivity. So you may find that your skin may become more red, more irritated, more sensitive, and also an increased sensitivity to the sun. So more likely to get sunburned, and that is also going to play into this skincare routine. Let's jump into the morning skincare routine for those of you who are on Accutane. So step one, you want to choose a very gentle and hydrating cleanser. Gentle because Accutane skin is sensitive, and hydrating because Accutane skin is getting stripped of its oils, so it's very dry. The first one I would recommend is the Cerave Hydrating Cleanser, and I use this myself actually as my regular nighttime cleanser. This contains 3 types of ceramides as well as hyaluronic acid, which is a humectant that helps your skin hold onto and retain moisture. It's also very affordable, it's very gentle, it comes in a large size, so I love recommending this to my patients. The second one is the Roche-Posay Toleriane Hydrating Gentle Cleanser. I love using this for Accutane patients, acne patients, and rosacea patients, as well as anyone who has a damaged skin barrier from using maybe too many actives. This one contains ceramides, niacinamide, which actually is an antioxidant, and it can help with brightening some dark acne marks. And it also has the La Roche-Posay Prebiotic Thermal Water. Both the Cerave Hydrating Cleanser and this LRP Hydrating Gentle Cleanser come out like a moisturizing gel cream cleanser. I really like the textures of both of these, and whenever my skin is really sensitive or irritated, these are my go-tos. Okay, next up in the morning routine is a good moisturizer. Some people ask me, Dr. Park, should I use a serum serum in the morning. I would say that's up to you. If you feel like your skin is extra dry, you can layer a serum in between cleansing and before moisturizer, but for most patients, a good moisturizer will do the trick. The first moisturizer that I'm going to talk about today is the Neutrogena Hydro Boost, and this is a discontinued form. This one's actually the gel cream for extra dry skin, but they got rid of this and they now just have a Neutrogena Hydro Boost cream. They got rid of the gel, so it's just a really hydrating and rich cream that contains hyaluronic acid, that humectant that we talked about, natural moisturizing factors, tons of amino acids, electrolytes, and essential lipids, or the fats in your skin, and ceramides as well. So I love recommending the Neutrogena Hydro Boost Water Cream to patients because it's affordable, it's very simple to use, it's no fuss, it's fragrance free, it's great for those with acne. It's super hydrating without feeling very heavy or greasy on the skin. So you can use this morning or night. The next moisturizer that I'm going to recommend is from Skinfix. This is the Barrier and Triple Lipid-Peptide Cream. This has a whole host of benefits and I reviewed it in a different video before, which I'll link here. It actually has phytosphingosine, which is an anti-acne ingredient, believe it or not. This is an antimicrobial and cell-communicating lipid that's part of the skin's natural defense system. It also has glycerin, which is a really awesome humectant, helping your skin hold on to water, just like hyaluronic acid does. It also has jojoba as well as macadamia seed oils for extra hydration and ceramides. And it also has some anti-inflammatory properties in the form of aloe as well. I love how thick it is. It is really, really thick. I think I demoed this in that video before, so you could see that here, but it's just a really thick and luxurious feeling cream. If you feel like this is too thick for daytime use, then you can use the Neutrogena water cream during the day and then save the Skinfix peptide lipid cream for nighttime. But I think this is a wonderful one for Accutane skin because it will really deeply hydrate your skin, and there's a whole host of these other benefits as well. All right, let's hop on over to your evening routine. This will be shorter because a lot of the products will be the same. So you want to start off with cleansing, and if you are using a lot of foundation or heavy makeup that day, I do recommend doing an oil-based cleanse first to remove all that makeup. So the one that I'm going to recommend here is the Versed Day Dissolve Cleansing Balm, and I went over this in a recent video about my winter travel skincare routine. This comes as a very lightweight little jar, so I like using it for travel, and it is very affordable at less than $20. This one contains all sorts of antioxidants like vitamin E, jojoba oil, eucalyptus oil, avocado oil, and clove leaf oil, and all of that helps to keep the skin moisturized. It does have a slight refreshing scent, almost like a minty smell. So if you don't like that, you may not want to use this product, but I like using this product. It feels really luxurious and just nice, almost like a little massage at the end of the day to remove all of my makeup before prepping my skin for the next cleanse, which is using the water-based cleanser. So I would start with the Versed Day Dissolve Cleansing Balm and then move on to either one of the two cleansers, the Cerave or the Roche-Posay one that I talked about in the morning. After finishing your double cleanse, this is where you would apply any prescription medications for acne that your doctor has recommended at this time. This could be in the form of topical antibiotics like Dapsone, erythromycin, or clindamycin. I would recommend steering clear of harsh actives at this point because you're already on Accutane. You don't need to also be using topical retinoids or retinol or retinol, and you don't really need to be using harsh acids either at this point, like physical exfoliators or chemical exfoliators like AHAs, like lactic acid, or J's like salicylic acid. Everything we want to do in our skincare routine for Accutane patients is to repair the skin barrier, fix the dryness, and really give your skin some TLC because the Accutane is working to dry you out from the inside. So we just really want to be gentle on your skin. So put all of those harsh exfoliants and acids just to the side temporarily. After you put on your prescription treatment, then you would apply your moisturizer, and you could use either the Neutrogena water cream that I talked about or the Skinfix lipid peptide cream. Either of those would be great at this point. After that, one thing I always talk about is slugging. So slugging is the idea of using an occlusive over your moisturizer in order to trap in everything underneath it, including moisture. And the most common things to slug with are Vaseline and Aquaphor. So if you've already washed your face thoroughly, you don't want to slug over a dirty canvas, meaning you don't want to slug over makeup or oil or impurities, dirt, sweat, grime, etc. So clean face, freshly washed, applied your moisturizer. If you want to, you can do a thin layer of Aquaphor or Vaseline, some sort of Petroleum based occlusive, all over your face. Now, if you have open wounds, I would not slug over that. So if your acne is severe enough where some of it has popped, there's pus coming out, there's an opening in the skin, or it's bleeding, do not slug over that because you might have bacteria on your skin and you would be trapping all that bacteria underneath this thick layer of occlusive. The slugging works really well to help counteract the effects of Accutane, which is that severe dryness of the skin. And if you have a lot of draining cysts, like I mentioned, I wouldn't recommend it. So this is really something that you should talk to your dermatologist about to see if the level of your acne can play well with slugging at that point. And it could be that at a certain point you can't slug, but then later as your acne gets better, then slugging is more of an option for you. Last but not least, I would recommend using something on your lips because Accutane patients get really dry, chapped lips. So you could use the same thing you use for slugging. So Aquaphor or Vaseline, petroleum-based occlusive would be great for the lips. I wouldn't use something with a heavy fragrance. I wouldn't use anything with urea, which can actually be too exfoliating. So just plain old Vaseline jelly would be sufficient. And if you know you're gonna be outside for a long time, please remember to purchase an occlusive or a lip balm that has SPF in it, because I've seen TikTok videos, I've seen social media videos of patients who have gotten really bad sunburns on their lips. And remember, Accutane does make you more sensitive to the sun. So during the day, opt for a lip balm that has SPF. At night, you can just use straight up Petroleum. All right, I hope that was helpful for you. I tried to make this a very simple, bare bones skincare routine for those of you on Accutane. And I also tried to choose more affordable products because I know many of you on Accutane are probably in your teenage years or maybe in your early 20s. And so you don't want to break the bank buying skincare while you're on Accutane. I know that being on Accutane can be a tough process. So more power to you for going through it. I have made videos on Accutane in the past that I'll link in the caption below so that you can learn more about this medication, side effects, myths, and misconceptions. And as usual, feel free to leave any questions or comments below. And I'm always looking for new topic ideas. I mean, this topic pretty much came out of one of your questions. Please stay in touch and don't forget to hit subscribe. We have a lot of cool stuff coming up for you soon. Until next time.